Position in that spot. Today is the first opportunity to be with us. Unfortunately, we're doing this through Zoom. And if you don't know her, you'll get a chance to meet her in our next in-person opportunity. But with that, I'd like to welcome Debbie and also give her the opportunity if she wants to make any remarks.
Well, I thought I was going to be in person in video, but I'm having some difficulties because I got a new computer. Thank you, Mr. Evans, for the introduction. It was really an honor to be selected by Russell Coleman. And since the commission really focuses on prevention and treatment, I'd like to give you an insight on hopefully how I can help in my role. You know, when you mention prevention, I've got 38 years, I know that's forever, of teaching experience in the elementary, middle school, and high school. So hopefully recognizing programs like, you know, the Better Without It will help in insight. And then the reason why this position was given to me, my family lost our only son, Zach, at the age of 24 to a fentanyl overdose. And when it came to treatment, my son was in rehabs, both as a juvenile and an adult. So generally, Zach was a well-rounded kid. He had a very encouraging future. He was successful as a student and an athlete. There weren't all the different obstacles going against him. But he started, like a lot of kids, you know, experimenting at the age of 14. So that use really became consistent at the age of 16. He was basically addicted. So emphasizing prevention to recovery, I feel that since Zach was in as a juvenile in 3 inpatient places in Kentucky, and as an adult, he was in an outpatient and then 1 inpatient at the end, which he chose to go in himself. So Zach had success, and that's what we want. You know, we're focusing on success of sobriety, and he had 2 years of it. But you can understand probably why it is a privilege for me to be placed in this position. You know, hopefully my experience and my family's experience and the love for my child can give you some insight. So, you have any questions?
Debbie, thank you. I'm not sure if the members, as you asked for questions, if any members have any questions or comments for her.
I don't have any questions. I just want to say welcome, Debbie. I look forward to meeting you in person. And I send prayers for your loss. And I know just hearing you speak that you will put it forward toward some good work with this commission. So welcome.
Thank you. And yes, I hope I can help you.
I don't have any questions.
I'm very excited to meet you all. I really am.
And I know.
If there's no further comments or questions, we'll move on. And Debbie, thank you very much again. We're excited to have you joining us. Look forward to you being a part of this process and this team as we move forward with the work. So thank you very much for joining us. Into the next portion pretty quickly. And just a quick update. One of the things we realized we didn't have on there, but the request for information, which we had talked about previously, which was going to look at supporting innovation and interventions and things of that nature. I want to make sure we're pleased to announce that request for information was recently published to solicit ways that the commission could use its resources and authorities to support the development of new or innovative interventions. This will help us take a broad look at some innovation treatments or technologies that we may be able to look into, and that's part of the earlier commission meetings where we talked about making sure that there was money set aside for that. So I wanted to make sure that you all know that has gone out. The link will be added to the website, and the solicitation will be open till December 2nd. So people are aware there is a gap. There is enough time for people to hear about this, to be able to build their proposals and send that information in. So I wanted to make sure that the commission members are aware that is taking place. And that is it for the executive director updates. We're going to move into the old business. And so one of the things we want to do is to make sure that we are productive with the use of time today. And we recognize you all have stepped on and we're trying to do this in a good way. One of the things that we wanted to make sure that happened was that we take the opportunity to follow up with the priorities meeting and to take that information with you all came up and what came up from the group and make sure that we and the staff have been able to distill that into the proper things that you all said in that meeting. So we want to use this as an opportunity to ensure that what we've heard correctly, and those things that you've talked about being priorities and ways that the commission should look at future applications is heard correctly, and we can use that information to move forward in future applications and processes. There won't be any votes on this today, so you should just understand what we're really trying to do is make sure we've heard correctly from you all and are moving forward in the lines with what you spoke out with that. And again, in the interest of time, this was put together by staff, and I think Deputy Director Halliday will be able to expedite this, quite honestly, in a way which will help us understand the recommendations as it was heard and as we'll move forward. And again, there's no votes, but we want to make sure we've got that. With that, I will turn over to Jesse.
Thanks, Chris. So, and apologies that this document didn't get to you sooner, but we just wanted to, I think you all got it from Allison. I'm going to walk us through it. There's some places we need some additional clarification. And also, if you feel like what we distilled from the last meeting, what we did was take all of the comments and try to really pull out the things where we had solid consensus, it seemed, in the group around things that we could move, as well as some places where we knew we could act for this grant opportunity. There are 3 places that I'll mention at the end that we think need some more time for us to develop a process around that we heard that I just want to, that I'll highlight for you. The first thing in the presentations you got in at this meeting at the meeting in July was sort of the introduction and overview of how people have set overarching priorities. And so you heard from Johns Hopkins about their 5 priorities. I think CORE told us what their 4 or 5 priorities are and how they've distilled them. So there's just a general question, and to remind you, those Johns Hopkins principles are that use money to save lives, use evidence to guide spending, invest in youth prevention, focus on equity, and create a fair and transparent process. I think what we would like to know as staff is, do you want to sort of adopt those sort of big umbrella? We don't have to, but if you all want to do that as sort of your general guidance, these are the things we use to frame how we're setting annual priorities. We can certainly put that out there when we share with the community what you all have said as a framework.
All right, thank you.
Does anybody have any thoughts about how you might want to adopt those or not adopt them?
I was going to tell you, I read through that.
I don't see anything on here I disagree with.
And it looked good to me.
Same here.
Same here. Do we need to flesh out the word equity? Is that clear for everybody? It's equity.
Certainly we can do that if you would like to. I know in some of our general conversations, we've heard the conversation revolve around racial equity, geographic equity, economic equity.
Yeah, all equity.
All of those things. Yes. So we can certainly make that part of it if you want to adopt that overarching. Yep.
We might need to, because I don't want people thinking equity is just one thing when we want it to be all things, inclusive.
Okay. Anything else on that section?
We might need to.
This is Trish, Jesse. I was just going to say, I don't see anything that I don't agree with either. The only thing I don't know if we want to continue to bring out, though, overdose prevention as well. I mean, I know we need to, it's listed in the document that you sent in terms of priorities. I don't know if we need to make that explicit, or I'm open to others' thoughts.
You mean invest in youth prevention, you want to just say youth prevention and overdose prevention? Is that what you're thinking?
Or it can be a separate item. I just think we can't lose focus on the fact that we continue to need strategies for overdose prevention.
I'm okay with that.
I agree because when speaking to students, I tried to mention Narcan, and they are not familiar with Narcan, and that would be a way to incorporate overdose prevention. They're not familiar because they're not really involved, but it's important that everyone knows about it.
It's almost expressed there, and the number one on the Johns Hopkins, use the money to save lives.
And also when we go down, Trish, into your specific grant opportunity priorities, we do list harm reduction there. So I think if you're comfortable with it being incorporated in use money to save lives, as Eric just mentioned, then we can get into a little more depth when we talk about the specific priorities for the year.
Yeah, that's fine. I just, it's an issue of mine that I obviously feel strongly about and passionate about with the past work I've done. So I just wanted to bring it up.
Absolutely. So it feels like everyone is comfortable sort of saying we generally use the Johns Hopkins model to reference, and as we're explaining, this is sort of the overarching principles we've agreed with. So then moving into the 2025 grant opportunity priorities, and
Jesse, this is Mark Metcalf. I don't want us to move on without just saying something. I want to make certain that we are not adopting a DEI model when we start using the word equity. I believe that, I think I'm quoting Vaughn by saying that we are open to all communities. We're not going to assess problems based upon racial profiles or ethnicity, but we are going to serve all communities equally based upon need, based upon the acuteness of problems, or, and looking at it another way, the absence of problems. I want to be certain about that before we're accused or comment is made that we're engaging in some sort of woke.
Right. That's why I wanted it fleshed out, because I wanted
to make sure that I was understanding you, you're understanding me. You've always been very clear and very candid with me. I want to make sure I'm equally clear and candid. I have real problems with a woke agenda. And this is without suggesting that anyone has even implied that. And that's all I want to say. I'm not here to, you all have heard me say several times before, I believe in diplomacy and speaking kindly to everyone and not criticizing. But I also want to be upfront by saying that I would be opposed to anything that would put us in a position of engaging in what others have characterized as woke politics. And I hope, by saying so, I hope I've not given offense to anyone by discussing this. And I'll just leave it at that.
I think the reason I wanted clarification in my first statement was to avoid the thinking that you're bringing up. I think it's, I think when we use phrases like any of that, we don't want to be misleading or insensitive. So I want it to be spelled out that we are looking at all people, applications, situations, all inclusiveness. And I don't even want the word inclusiveness to get any kind of reaction, but I just want to make sure we're looking at everyone's situations in a fair and kind-hearted manner, if that's possible.
And Vaughn, you and I work very well together, and we may come from different perspectives, but I really appreciate you and have enjoyed working with you and sharing ideas with you. So I think we're on the same page.
I think we are. I appreciate you saying it. That's why I brought it up, because I want to make sure everybody's feeling okay about the way we look at the applications, and we're all be of like-mindedness when we make decisions. If we can, as much as we can.
And the only thing I'd like to add is, we just need to follow the data. We're seeing overdose deaths increase in communities and particularly African American communities, and we just need to address what we see in current data. That's all I'm saying.
And that will take us to the road of the prevention mode as well. If we're going to see where that data is taking us, if there's an issue in a particular community, we as a commission have to look at how we prevent some of that. So I want us to take a look at of course, always consider the data.
And it's why Eastern Kentucky is so important.
Right.
Also in the analysis. I mean, that's what we see. So it's current data. We need to respond.
And Dr. Friedlander, I'm glad you brought that up. Looking at data, assuming it's good data, and I have no reason to doubt it, I think it can very affirmatively guide our efforts. And I want to thank you for adding that as well.
Thank you all. And we can definitely define equity further, and we'll follow up with what I'm hearing today with the full sort of scope of what it would look like from a public view. So looking at the 2025 grant opportunity priorities, I took, like I said, what you all had discussed and where there seemed to be consensus and some synergy around areas where you thought there should be priority focus. We're going to recommend as staff that we do 2 separate notice of funding opportunities to help provide that clarity, one for treatment and recovery, and one for prevention. And they would follow the same traditional committee structure. It would just be 2 separate notices of funding, which I hope would bring some clarity to what should land in which committee, as well as clarify some of the asks. And our thought would be to open that grant period at the same time. They would overlap, but it would just help with the organization. That's what we were thinking. What we heard in treatment and recovery was that based on the research in residential treatment bed availability and where Kentucky is ranking, that there was less interest in funding treatment beds from this commission, that would be a lower priority, but recognizing there may still be areas where there would be gaps in services or some additional treatment would fill a significant need. We're not saying no treatment applications will be submitted. In fact, we're not saying no applications would be submitted at all if it meets those criteria. This is simply your priority, and we would want to say that any of those applications would have very specific detail about why those treatment beds are needed and what gap would be being filled. Dan, I see your hand.
Yeah, I want to go back just a minute to the separation of the 2 projects. Especially in year 1 and some in year 2, we saw moonshot grants that were just huge grants that tried to do a lot of different things, prevention, treatment, recovery, all pumped together. Would it be possible for staff to look over these grants before they're assigned to a committee and make sure they meet the criteria of prevention or treatment and recovery, and they're not jumbled together?
Yes. And I think that's why also having the 2 notice of fundings will help people to clarify whether they're asking for a prevention or a treatment recovery type ask. I'm sure we will get questions about whether or not they could apply in both categories, the same organization. And so I think that is something we need to probably have some clarity from the commission about whether they would.
That will happen for sure.
Yeah. So agreed with you. And yes, we are talking about how do we do some staff screening. And I think this is all part of that process, like being more clear about what we want in applications so that they may not all make it to the committee to review.
Yeah.
Was there any other question about sort of the approach to treatment itself?
No, I think that's what we've been saying.
this will just make it more clear from the beginning in terms of your priority, I think.
Jesse, let me ask a quick question. Am I missing, we don't have, when we say barrier relief funds, do we want to talk about, or am I just missing the legal aid piece? Like if someone needs legal support, they've got those kind of issues. I know we had some proposals that came before us this past year. Where are we putting that in this list of considerations?
So I think, yes, that moves us perfectly into the recovery part of that grant opportunity.
Sorry. Okay.
And I think you obviously, in your discussion, feel that there needs to be investment in recovery supports. The most common places we heard that in the discussion was supportive housing, transportation, employment, workforce development, family togetherness, and barrier relief funds. I think, Vaughn, in your example there, that the legal aid could make an argument that it could fit into several of these, right? That they help with housing support or family togetherness. And so that would move those kinds of requests that would support into the recovery section.
Okay, so that would mean you also look at their expungement of records or anything like that, expungement, that would go under? Or with independent organizations like the Urban League, they have a program just for expungement.
Mm-hmm.
Is that
I think it would all go under recovery support.
Okay. Thanks.
Are we at that place, Jesse, to talk about what's here in recovery supports?
Yeah, I mean, I think one, I just want to make sure we didn't miss any other area you want to highlight as something. I mean, these were the ones you talked about the most, which indicate to me that you see the priority needs for funding. We can take anything off or add anything here.
Not anything to take off, but I would like to add recovery community centers. That's been something that CORE has focused on. It's done really, really well, been very successful in a lot of communities. And I'm not saying we wouldn't fund it, but it's not in here. So I just
Is that different from supportive housing? What is that? Help me out.
Recovery community centers are
more than that.
They're drop-in centers, for another explanation, where people could go to find help for transportation, for housing, for employment, for sober activities in the community.
Okay.
Help me out here.
Certainly add that as a priority area. And I would also just point out that, again, like this doesn't mean that if it's not specifically listed here, that it can't be applied for and you can't consider it. It's more to help guidance on when people are looking at what is the commission really interested in. I think we can certainly add recovery community centers as a list on here, but it is also not restricting any request in recovery support.
Okay, that clears. Yeah.
Explicitly, just in that they're a very effective mechanism for folks to sustain their recovery by offering a sort of single co-location site where they can receive employment supports, tenancy and housing supports, transportation, but also develop a healthy peer group so that they can interact with others who are in recovery, provide mutual support. The communities that have them have embraced them. They often very much become locally supported. But we're interested in seeing them expand to more communities, and sometimes initial funding is the challenge. And so that could be explicitly stated. I think the cabinet would be in support of stating those as a stated priority.
Yeah. Okay, I hear consensus around adding them as a named item in priority as supporting recovery community centers.
Agreed.
There was another question just that needs a little bit of fleshing out in terms of the commission. When we talk about barrier relief funds, in that category, we think about things like rent, mortgage support, childcare, work equipment, gear, some of those kinds of things. I guess one of the things we'd like to hear from you is if you think there are any restrictions that should be placed on that. Like, should we not be using money for something in particular that might be falling in that category?
I mean, do we have restrictions on how much mortgage or rent we would pay? I mean, we can't. I mean,
It's a
do we
really
do that
good
at this
question,
point?
Vaughn. I have a barrier relief funds that I issue. And if you start paying rent, man, it could eat up your funds really, really fast.
So
It's something
there has to be some kind of
to,
restriction on there.
yeah.
So I think we could probably do that in a couple of ways. You guys could either set we will not do rent, we will do only up to 2 months of rent,
right.
Or we could mandate that anyone asking for barrier relief funds provide a detailed account of how much would go to particular buckets or something, like what they would want to spend it on. We can ask for a very detailed list of, if you're asking for barrier relief funds, you must tell us what that includes specifically.
Yes.
You know, I don't mind to pay for rent in a recovery house where somebody's in a recovery home, but just paying somebody's rent for their apartment, I struggle with.
Jesse, I agree with Mr. Ingram on that, or Van on that. Many of the people that we're going to be dealing with certainly have some sort of housing situation, whether it's a home or an apartment, and these are the places where they've gotten addicted or become addicted, and they go right back to the same place. I don't want to see anyone lose their home. I don't want to see anyone lose their apartment. But they have to give up bad habits. They have to acknowledge that wherever they're coming from is the same place where their addiction was either started or facilitated. And I think we need to be very, very careful about providing this kind of money because I think we'll find that a lot of people who may not have much of a problem at all will be applying for these monies if we make this kind of thing available. My experience in running a local anti-drug coalition was our first step was to identify that there was a problem because they admitted it or were convicted of something, and then we moved them on to rehab. And many of the people who had these problems couldn't pay rent to begin with, weren't paying rent. I don't want to put them into a situation where they go back to a home or to an apartment and then pick up where they left off. So I would be, I think the best way to put it would be 95% opposed to anything where we're making mortgage payments or making rent payments. It's hard for me to imagine that that's going to help solve the problems we're trying to solve.
I do think it would, what your concern would, and Van's concern would be addressed by what Jesse stated earlier about a distinct some kind of overview or details on what you want the funding for. And so I think it will be included in that, hopefully, correct?
Yeah, I like the
we'll ask them to
limitations.
detail, yes. Dr. Brenzel?
Yeah, I think just a little bit of a countervailing argument. It's one of the most critical phases in someone's recovery is often their transition from transitional housing or residential to a community. And so very often one of the barriers is first a deposit, and some initial first month's rent. And so some limited supports for tenancy supports is what we call it here at the cabinet. We have some waiver programs now. They're going to consider the possibility of adding tenancy supports, but certainly not paying ongoing indefinite, rent, or because often these patients are trying to relocate from the area which they were involved with drug. They're trying to get a job in a new community. They're trying to establish themselves without supports so that they don't return to the setting in which they came. And so for those cases, I think if a project could describe that they're assisting someone in transition by providing, initial month's rent and deposit to allow them then to sign their own lease, have their own apartment, and pay their own rent in the future, I think that's a worthwhile, and that's the way I would look for limitations on it.
Well, and then I'm going to say that I think is the better approach. In other words, after rehab has been completed or we're nearing the end and we're trying to transition people, as you put it, sir or doctor, I'm much more favorable to that approach than prior to rehab or while they're in the throes of addiction. I think that all that does is add more to the problem and facilitate more addiction, not less. But I also want to point out that the rehabs that I worked with were already providing transitional services. Now, those may have been the product of getting grants, may have been a product of some financial assistance that they were able to provide. I don't know what the mechanism was for that, but we're not inventing anything here. I think we might be providing services that are already being provided, and I don't mind doing that. But I want us to be very circumspect before we start writing checks for rent. I think Jesse's point that there needs to be a case made for that that's highly facts specific is the right way to do it. Even if we embark on that, I want to see compelling evidence through a personal narrative, and also being mindful that some of these transitional services are already being provided by some of the rehabs that I'm sure are going to be applying for these monies. So I think we need to be very, very careful with rent and mortgage payments.
I agree.
Thank you, Trish.
Yeah, I was just going to basically say the same thing that Dr. Brenzel did, that I really believe that there are important individual situations in which these types of supports are going to be instrumental in an individual's path to remission and recovery, and to just, make a blanket statement when it should really be approached from an individual situation, I think is important for us to remember.
Yeah. I think, Jesse, if we could use Dr. Brenzel's analogy, in the description of barrier relief funds, we could point those things out to the applicant.
Yeah. Jason?
Yeah, thank you. I was just kind of following up on what Trish had shared about trying to not make it a rigid cookie cutter type of policy that just lands on everybody. If we can somehow be responsive to the individual need, I think that's practicing more compassion and wisdom on this front. So yeah, just reinforcing what's been shared.
Chris?
Yeah, just a quick question for you all as a group. Then, as you all were talking about this, the overriding thing for me is, do you want it to still stay as a priority, or do you want it just as a priority with more description so that it's clear that it's a limited priority, or there are some limits to it? So, and because there was a lot of concern just about it overall. So my question is, hey, do you still want it a priority? As if it's a yes, it's clear you want some language to show that is a limited thing.
In my mind, it's still a priority, but I think a good description of what barrier relief funds can be used for would be helpful to grantees.
So we can, it sounds like there's agreement, like we can say barrier relief is a priority and that it will be required in the application for a detailed description of, and then in your deliberations, you'll be able to do what you always do. Did the organization make a case for those barrier relief funds and the way they intend to use them?
You could make the statement, barrier relief with limitations.
Okay, yeah.
So it's not an open.
Right. Well, and all of these things are all subject, right, to the description and the case that is made by the applicant in terms of how they will. So anything that falls in the priorities, it's still going to come down to how was the application presented and your assessment of that application and its description. So, all right. So it sounds like with the addition of recovery community centers, we have a comfortable list of priorities in recovery support. So we can do that. So then for the prevention grant, through the conversation, it seemed like there were three major areas: youth focused prevention, which would be in school and out of school programming, and then overdose reduction efforts. To your point earlier, Trish, about overdose prevention, and we can say overdose prevention efforts as well, either way, but those were the areas of prevention it seemed like there was a lot of consensus around. And there's a lot of room in those areas for different kinds of proposals.
We're not using the word education at all. In the prevention realm, we're going to say we're calling in programs, out of school programs. Are we going to try to, I think, do we want to put in the word education? It's not, prevention is a part of learning about what it is you don't know about necessarily. So we wait till we get to these applications and they jump straight into a program. A program is kind of an overarching term for, to me, we should catch them early on, if you will. So I think the word education might be helpful here. Someone else on this call might have a little bit more insight there, but I'm just thinking when we just say the word program, I don't want us to.
We could also say efforts instead of programs if that feels less like it has, like a very specific concrete program, if that feels like a more all-encompassing in-school efforts and out-of-school efforts.
I still like the word education, but to me, education is again the learning process of. If a child doesn't know that their drink can be laced with fentanyl, is it too soon to teach it? When do you teach it? And I don't know what programs are like just yet. And I don't want to lead into anything that may not be going on right now. Maybe Eric has a little bit more insight there. But I just thought, is there a better defining factor of what we're actually trying to do with prevention?
Well, and I think part of the question that came up with this, and apologies just for hopping it, was when we looked at it, was those broad categories allow for all those things that you're talking about still to walk through the door for the group to make an assessment on. And I think that was where it got to the question of how specific do you want to get? And these seem to be broad enough to really kind of let all those things you're talking about still come in.
I like the word initiatives better, but that's because it's just less programs.
We can do that.
Okay. You could say you said what, efforts too?
Yeah, initiatives. It's Trish.
Yeah, I know we've talked before about how we're defining youth, and do we want to be more explicit in that so that everybody is viewing youth focused prevention as the same age group?
That's a good question. And where do you cut off? Where do you even start? Do we want to say middle school, high school?
We're doing, for the prevention model, the trait-based prevention, we're starting in 3rd grade. So like what we've learned from teachers, staff and faculty is like, you really can't begin early enough. And I think proper perspective.
I think we've seen some efforts starting as early as kindergarten.
What?
I don't know. With kids, I agree, 3rd or 4th grade, because they are recognizing their situation at home and with their friends. But kindergarten, I've subbed for kindergarten. They're really focused on where's my coat and where's my friend. So, but again, they need to be able to recognize an uncomfortable situation and acknowledge it.
Do you define youth as elementary, like elementary school aged? Okay. So it's not just limited to.
Or you could set a top age and go all the way from, I don't know that you necessarily even have to.
With the grade level.
There may be, there may be some parenting things that really would fall in a youth prevention if you're talking about early parenting. I don't know what could come through the door, but I'm just trying to think not to limit yourselves too much.
Don't limit, and also don't necessarily get in the weeds where a parent might be offended if they think something is being taught too soon. But again, in this situation, we'll be looking at each application independently. So we will have the data and all the information to make an informed decision. So I don't want us to cut it off, or just like you just said, Jesse, look at possibilities if needed, and if the data bears fruit for the particular situation. So I'm open. I just wanted to, if Debbie wants to, Patricia wants to clarify age, I'm fine with.
I like age.
Okay.
I do.
Well, I just think, sometimes people think about youth up until the age of 18, right? And then all of a sudden they're an adult. And so thinking about that upper end, I think is also going to be important too for some of our community-based prevention activities or out-of-school prevention activities.
And some grants go up to like 24
Right.
in this situation? I think they do.
You just approved a Better Without It
26,
project, which goes to 26.
We define transition age youth as up to 26.
Yeah.
So I think that's the question is I think we mean children and youth. And then the question is, do we want to set an upper limit of 21 or 26? But this also doesn't mean you're not going to possibly fund prevention programs for adults. This is, again, just saying this is a priority.
That's why I don't want to.
Because we need prevention programs in the elderly as well as we need them in middle age. We need prevention programs through the lifespan. We're just saying we're prioritizing child and youth prevention programs.
Right, and we're not going to forget about the other if the data brings it forward, right, bears it out.
I can offer up some of that qualitative data, Vaughn. I didn't get high until I was 20 years old. So that actually is kind of what initiated my 17-year path of active addiction. I was fine all through school, but when I graduated, I left behind some of those resiliency components and self-understanding and self-awareness. So yeah, whatever I think we can do.
You all know I have a 19-year-old, so I'm always conscious of it.
Right.
Is that what we want to do? Or
Do we want to agree to 21, up to 21?
Can I make a suggestion on the age limitation? Sometimes you have some students who might be a senior in high school that, of course, if you're going to age 21, you might have some kids in elementary school that might be a little older, as 5 years old. They could be in first grade, or I don't know. I guess I just want to not exclude anybody on the age if they're a little older or younger in a certain grade in school. If that makes any sense.
I heard 21 or 26 is sort of the standard youth cutoff ages. Which we can say is defined under age 26 or as your priority or under age 21. But to Dr. Renzel's point, this also doesn't rule out a adult-focused prevention program coming in and being approved. This is more about how you're going to prioritize what available money we have.
And I tell you, a great opportunity that could be met in the state would be on our college campuses, actually. And I know of no one that's offering programming, and there may be, not to say that there's not, just to my level of familiarity. That's a big gap. And you're talking about like the 18, 20 to 21, 22-year-olds. I think some type of support group, if there's any funding to, kind of help advance that mission, I think that's an area where if we create a limitation on the upper end at like 18, for example, or senior year, we may be missing some of those college students that still are, quite frankly, a bit impressionable or facing some very serious temptations to experiment and all that. So, yeah, I think that's another consideration as well.
I would say 26 to make it in line with the other program that we talked about previously.
Okay.
The priority.
Is everybody generally comfortable with that?
Yes, I'm comfortable with that, guys.
I'm okay.
Okay.
I'm okay with that. Jez Hewen or Allison maybe asked the question, but I do want to just very briefly chime in here on an issue, and that was about what's the floor here regarding ages. And when I was running a local anti-drug coalition, we were meeting with school officials and asking them to build in into the curriculum, and they told me they were doing this through their health classes, an anti-drug message, and being very proactive in presenting that to the students. part of this was prompted by the fact that we had a 12-year-old overdose back in Garrett County, and she died. And so I think the need is there, and the need for education, specifically the need for education, is there. So I don't think we can start too soon. I heard someone mention kindergarten. We all know that parents who are use regardless of the age of their children if they have children. So I think that is something we should be open to in terms of educating in the grades. So I want to put that out there. My own personal experience with it was when you have a 12-year-old dying at home because they got into the medicine cabinet of a family member. I don't think we can start our education too soon.
Thank you, Treasurer. And again, each application will be reviewed for the specifics, and you can assess then if it feels age appropriate for what the ask is and have those discussions.
That's a better approach. I mean, we case by case basis.
So I think for the priority, we'll do youth focused prevention, defining youth as 26 or under, up to the age of 26. In-school initiatives, out-of-school initiatives, and overdose reduction or prevention efforts. I think we've reached consensus that those are the priorities. I'm going to skip over the innovation grant because Chris already talked about that, so you know where we are on that. There were several things, and I think we can get through this relatively quickly because I think there's a lot of consensus here. On the grant review criteria, the major areas we heard you talk about were collaboration. Van, sorry.
You know, I'm not going to let you just run past innovation grant research opportunities.
Okay.
I struggle with, and I don't know what the RFI looked like, but number 2 in our guiding principles is use evidence to guide spending. And so many of the projects that I saw that come across our desk and come through this office on innovation and research opportunities, there's no evidence to show that this is going to work or doesn't work. I mean, as people come in here over the last 10 years, always with the latest thing that's going to fix the opioid crisis, and I say, well, where's your data? Where's your evidence? And they don't have it either. They all want to do a pilot. Wants the state to fund a pilot? Well, I don't think that's taxpayers' job to fund somebody else's innovation. So I just hope that we can find a balance in this innovation and research grant opportunity, because most of the ones I've seen, there wasn't much evidence to say this was going to work or not work.
And I'm really only skipping over it because I expect that once the RFI piece comes in and we see what the responses are, what the types of funding needs or requests are articulated, we will come back to you for a notice of funding on that particular one. We won't have that information back till after December 2nd. So we don't anticipate opening that until much later. And so we will have time to talk about it and what criteria you'd like to build into that notice of funding to that point.
Thank you.
And Ben, just so you know that the data is a part of the question that's asked in that RFI. So there's a portion that retreats to that.
And they should, and Van, that's a good point on the pilot. They're not going to have any data from operations, but they should at least have some theoretical data. At least what are they building this understanding upon, and pointing to the literature, pointing to some of the studies that have previously been carried out. For example, like this program reduces anxiety by X amount. And so if they have that data in hand to kind of support their initiatives, then that somewhat lends to the satisfaction in those areas in some regard. But I do agree, Van, that as far as the state supporting a pilot, it's a little questionable.
Thank you all. So for grant review criteria, we heard you say collaboration. So the recommendation would be that we include instruction in the application that says if you are partnering with an agency, there needs to be some documentation that the agreement has been reached, right? That both parties are a part of it. I think that you mentioned that in the July meeting. So adding some more specificity around collaboration support in the grant application, and that will be a priority criteria. Supplanting, we drafted some concept that priority will be given to projects that expand or enhance services or opportunities. Supplanting of funds is discouraged and will be considered within the grant review process. Is everybody comfortable with that? All right.
Yes,
I
that's
know
good.
we've talked about this before. We've never explicitly said it, but that if you're asking for funding for recovery housing, there must be documentation provided that it's NAR certified, or given that there may be some delay at the state, that at least they've started the application process for that. If they're not all the way through the process, that's okay, but there will have to be that certification.
And Jesse, I wanted to add that I discussed that in terms of transition as opposed to introduction or prior to entering rehab. For the reasons I've given, I'm not going to restate that. Everyone's heard me out, but I do want to make certain that that point is at least in the narrative here about housing.
Yes, and this specifically mentions recovery housing, which I think is implies that it is post-treatment support.
Thank you.
You are so right from a personal experience that the movement of a person out of that situation after going through rehab is essential, because they go right back into that pool of people. And being specific, I mean, that is one of the biggest things that we found. So I think that's a great statement to inject.
Thank you, Debbie. We heard a lot of discussion in July about the investment of local abatement funds. So we're recommending that we more specifically ask that in the application process, whether or not the organization applying has applied for or is utilizing any local funds. We haven't had an ability to track that. So we wanted to ask more specifically about that, hearing that we want to make sure we're braiding and using all the funds that are available. Other grant funding, I think we specifically, there has been an interest in, I think previous applications have asked for like all grants coming to the organization, and it's a very long list sometimes. I think we've particularly talked as a commission about core funding, ODCP funding, SAMHSA, other opioid specific funding, and grants from private, state, or federal sources. So we'd like to know if an organization is receiving opioid specific funding from any of those organizations. And then also additionally, what other funds are being received for the project that's being asked for. So specifically capturing how an organization is using opioid specific funds, maybe not for that project, but also what other funding is available for the project they're requesting money for. Is everybody comfortable with that? Okay.
I am.
And then, again, like just a better description of what service gaps are being, so that you can prioritize more areas where there may be gaps in services, so we can get some better descriptions on that. So not only just saying, does your organization cover the whole state? Where are you located? Which counties can be served by this project? But then also which counties primarily benefit from the organization's current services. So while you may be statewide, if all of your clients are coming from just one county in that region, helping you have that information to make decisions with.
I just have one question.
Yeah.
I know you all are limited with staff, but are you going, if the application's submitted and these questions aren't answered, are you going to kick them back before they come to our committees, or will they come to our committees and then we kick them back collectively?
It'll depend on the amount of missing information. I think if there are significant holes, our thought would be that they don't come to you because you've identified that these things are priorities and they haven't answered more than half of these questions or provided the information. We'll look for completeness.
So you get it for 29 minutes.
Does that help?
55
It
seconds.
does. I just know it's a lot of work for you all. And unless you're getting a bunch of interns during application season, it's going to be a voluminous amount of work. So I was just curious. If, I know last year we had a lot of these that came to our committee and then we kicked them back for further information. And I'm just curious if maybe this year we could eliminate some of these basic things that the applications didn't meet the criteria for.
So are you suggesting they don't even make it to us, Darren?
Well, I don't know. I'm just throwing something out. It seemed like we had a lot of, we had to ask for further information last year. And I don't know if we catch that in the beginning and send it back, but I know that's a lot of work on Jesse and Allison. So just putting that out there.
We're just hoping that some of this education, putting some of this out there more directly and with more detail will help improve that in the application to begin with, so that you might not have to kick back. We're hoping this whole exercise better informs folks what we're looking for. And I also think that there will be applications that we'll say are just not complete enough for your review. Mm-hmm. And then there will be questions that you have that we will try to get answers to. There'll be a little bit of all of that back and forth. And I appreciate it. We're also making contingencies to make sure we have additional folks available to help and work on that by the time this happens. So,
well, I know transparency is one of our guiding lights. However, it's a lot of work, and it gets to a point where if you can't even fill out the basic application correctly, I don't know that it needs to arrive in front of us. So just a thought.
Darren, that's one of the things that we've had that discussion, and you all have talked about that. Is look, if there is a basic level of understanding and competency that has to be included in the submissions, and if there are submissions which don't come close to that, then it's not incumbent upon the commission members to go through and try to fill in all the blanks. We expect people to, and that's part of this process, is making the applications better, smoother, easier for them to do that. But we do have an expectation that people complete that. That's not unheard of, as you all know. In the grant application process, if people don't complete the grants as appropriate, then very often those grants don't go through. We're not looking to knock everybody out, but we are looking to at least have a reasonable opportunity for submissions. If there's somebody forgets to check a box, well, no, we shouldn't necessarily just bounce them out. But if somebody comes through and there's 4 or 5 substantive answers or questions that they don't respond to, well, that's something which should not move on to the group. And so that's kind of part of the looking at. I think that's been a consensus that we've received from this group. So we plan to move forward in that way.
And I think the intent is that if you all agree that these are sort of your priority criteria, obviously financial information is not on here. We intend to collect financial information. So that, I think, was an unstated priority. But in terms of these will help us to guide staff on if there's a lot of blank spaces in these areas, it probably doesn't need to go on to you. The one here that I think might have some discussion, and I know we're at the hour, so I want to make sure everybody's comfortable spending a few more minutes, that the conversation you all had around continuation funding or length of funding availability for organizations to continue to apply for abatement funds. So I think at a minimum, what we heard some consensus around was that the commission will consider continuation funding requests, though no guarantee exists that funding will be supported beyond the initially funded project. Requests for continuation funding must articulate a sustainability plan that will continue the project long term. That's sort of what I heard some consensus on. There were 2 points that I thought could be explored if you wanted to. Do you want to include a time period that restricts continuation funding? For example, no organization that has received funding may request funding for continuation of the same project for more than, and then you set the time limit. Is that 2 years, 3 years, 4 years, whatever that is? That's an option. The other thing that I think you could consider is priority consideration for continuation funding will be given to organizations that can decrease their ask for support for ongoing funding, so that they show that they're stepping down and building that sustainability. And so maybe you don't set a time limit, but you show some other, you could do both. You could set a time limit and a step down, but, and again, it's all around priority being given. So you can consider other requests, but this is the way to articulate what you're looking for from people for a continuation funding.
I've seen a number of federal grant opportunities that say continuation funding will only be 75% the next year, or then 50% the third year. So you're stepping them down and showing, like you said, that they just don't think this money's a guarantee. They don't have to go out and find other funds.
And also, if I know I've been vocal about this. If there's an organization that gets $1 million every year, I don't think that's fair, even though they may be doing good work. I mean, as you all know, I write grants here on my job, and we can't go every year and get $1 million from the same funder. So are we considering continuation, that they can continue consecutively for 2 years? Or are we saying every other year they can come back? What does that need to be addressed, or we'll just address it by a case-by-case basis? But I don't want some of the larger organizations thinking they can come every year and get $1 million. Maybe my opinion is we should spread the fundings across more organizations if possible, but it may be a year that a lot of people don't apply. So we don't want to totally cap it if there's not really a reason or the funds are not being used. So I don't want to make a blanket statement, but I also want us to be sensitive to some of the other organizations doing good work across the entire state. So I don't know what everybody thinks about that, but that's kind of my position and why I was vocal about continuation and capping and all of the above.
Just to be clear, this language is related to only continuation funding for the same project. So coming back to ask for the same support. So Vaughn, to your point, it wouldn't eliminate an organization coming every year with a different project and asking for funding. You all would have to make those determinations.
But I'm smart enough to know, I'm smart enough to change. I'm at Simmons College of Kentucky. I'm smart enough to say, well, this year I'm gonna ask for this, next year I'm gonna ask for this. The question is, they're gonna be smart enough to say, well, this year we wanna do it for our youth program, and then next year we wanna do it for, in larger organizations. We just have to consider everything.
Yes, that is not the contemplated question though in this recommendation, is whether you want to do that would be a separate question. This was more specific to
can they continue
funding the same programming repeatedly over a multitude of years. And I know there may still not be a real solid answer, and we don't have to decide all that.
When you say programming, it's assumed that it's a program that impacts in the opioid space, correct?
Yes.
But there's a diversification of the various programs throughout any organization, whether focused on the senior citizens, youth, etc. So are we saying it can be the same organization with a different program? That's what I'm hearing you say. Do we want to even say no organization can come back more consistently than every year? That's what I'm drilling down to, because I know that they will be creative in their funding requests, and I don't blame them for that. I'm just saying, what are we as an organization or as a commission prepared to consider, not consider, or do we want to just wait and do a case-by-case basis? Because do we want the same organization every year, legal aid every year, to get a grant every year? Or do we want them to if they get a large amount, 500 and above, do we want them to wait till skip a year and come back a following year? At certain levels, do we want to do that? That's a discussion. Otherwise, we'll be in the commission meetings voting on these, and these sorts of things will come up. So I'll put it on the floor.
My question is, what about an assessment of the program and then discover the strengths and weaknesses and then design your program from that? They have to have some kind of data to prove success. So in your question of should it be the same program? Well, it probably wouldn't or it would either be a continuation because of successful numbers or because of its not being successful, we're going to change the program. You just have to have that data. And a lot of people that they leave that last component out.
Yeah, and sometimes it takes a minute to get outcome. So I guess I'm okay to look at it, the applications individually, but I just want us to know that if they will ask for a continuation if we give it to them. So we as a commission, again, have to decide if we're prepared to do, and they're all doing good work. There's no question about the work that's being done. The question is, do we want to fund them without, are we going to require sustainability? Are we going to require, what are we going to require? And I know you brought up some of that, Jessica, so don't forgive me if I'm not quoting it specifically, and I'm looking away from the piece of paper right now, but I'm open for discussion, but I don't know if it's better to address this up front now or wait on a case-by-case basis. Either way, I'm fine.
Secretary?
No, I was just going to say, I do agree. You got to look at the data and they should be able to generate some, but I also really like the idea of stepping people down, that maybe it's over 3 years, right? But the expectation is, and if you step people down on a percentage basis and they know that it's not, like I say, if it's 3, okay. I agree, Vaughn, if we do continuation for everything, then we won't even need to have a grant process after a while. So it just,
right.
I think it takes a while for programs to hit. And I also think if you can wean them off of this dollar, which is going to go away eventually anyway, we probably should do it.
Just to add that I think that Van Ingram's point is correct about stepping down. I've heard other members of the commission or other commissioners say that, and I think that's the right way for us to go here for the reasons Dr. Friedlander just stated, that these monies will go away, weaning these groups that will be out applying for funds and receiving them, weaning them away from these particular monies, I think is the right thing to do. Gives others the opportunity to come forward. And with respect to continuation, at least it does not give them the impression that these monies will be continuing on any other than a step down basis for a limited period of time. And for renewal purposes or for continuation purposes, I think the point about following the data, starting with a group of users or whatever, however we define the group, and then looking at the outcomes at the end of whatever period is adopted is absolutely the right thing to do to assess success or non-success. That's all I've got on that.
So it sounds like what I heard from this discussion is that continuation funding requests will still be allowed, that there's no guarantee. It's still an annual decision. Each year will be assessed if continuation funding is being asked. So therefore, your review of outcomes or past performance or how they've done that first year can be a factor. And that the language around priority consideration for those that step down their ask. We could automate an ask of 75% and 50%. We can set a percentage, or we can just say all continuation fundings must show a decrease from the previous year.
Jesse, I think since you're talking about the funding caps in the next little bit, I would say that we be explicit and say if you're applying for continuation funding, that for the same project, that it should decrease by
25%.
25% each ask. I think that makes sense to me.
But key word is the same project.
Yes. Same.
No, is that key? Is the project, is that, if I'm an organization, I'm going to switch what I ask you for the next year, if you tell me that. I'm going to ask you.
But
so
you then can't use the funding to fund what you had before. That means you wouldn't.
But you can still apply, but you can move it over to a different program.
Write a new proposal, yeah.
Right.
Yeah.
That's what they're going to do. we'll just take a case by case basis, but I think we just need to be aware of the situation.
Yeah.
Just to be clear, Vaughn, you just said case by case situation, but if I'm understanding what the group has said also, you still want the step down inclusion into that process.
Yes.
Yes.
Okay.
For the same project.
For same project.
And Vaughn is saying if it's a new project, it'll be evaluated
Right.
as a new project.
One thing we've done though is
sorry, Dr. Brenslow.
Okay, I'm sorry to interrupt, but one thing what we see sometimes is they'll take the same project and expand to a different population or expand to a new location. And so that you'll have to decide. And so we'll just have to review that, right? So if you have a model that works and then you want to add 12 more counties, that's technically not a continuation grant, right? That's a new target population and a geographic expansion. So, but what we wouldn't do is keep funding for the original 10 counties.
But again, if we think an organization is doing great work and impactful work, and we look at those proposals and we've gotten outcomes data, there is no reason not to fund it. So, I mean, I think we'll all look at it objectively, but I just wanted to bring to everyone's attention that if there's an organization that's smaller who needs this money for whatever reason because they're doing the work and we're one of their few income streams, then they're going to apply as they should. So I just want us to, and I'm sure if we see the same organization applying, we will all look at it fairly and make a decision. So.
And then just the last one that we heard was outcomes over and over again. And so requiring a priority piece that you're looking at when you're assessing is what outcomes does the organization have to show that they're able to support, but also what outcomes do they plan to track? So there needs to be detailed, which I think has been happening and you all have been using, but just clearly stating that's a priority decision point for you all is how our outcomes are articulated to be tracked and followed. So very quickly, the last thing that's not completely baked from a staff development process, but we heard you talk about $1 million being a lot for most organizations to be reaching for, not wanting to lift a cap because that creates its own, still think $1 million per organization is a reasonable cap, but stepping down the requirements under a tiered system. So if you're an applicant who's only applying for $80,000, do you have to provide all of the same level as somebody who's providing $1 million? And so we're trying to figure out what those things would look like and how that would be a factor, but just trying to think about barriers to applying. If you're a smaller organization looking for a smaller amount of funding, maybe you don't have to provide the same level of things that a $1 million grantee has to provide in your follow-ups. Is there any thoughts or discussion about that? We're still trying to work that through of what it would exactly look like, but would love input if you have it, or we can follow up with you individually if you have ideas.
I don't know what you could leave out. Even if it's $80,000, you want to know that there's accountability for that money, that they know how to handle that money, that we're not going to read about it on the front page of the Courier that it was used for something nefarious. So I don't know. We'll listen to anything y'all come up with, but I'm not sure what you can leave out of the process.
We're also fine if you're comfortable leaving it in that same way and we think we're narrowing down the application to be more succinct. I think we can leave it as everybody have the same criteria. That's certainly simpler than setting up different structures as well.
As a person who writes grants for this institution, I think the criteria has to stay the same. The supporting documents are what we look at to make the deciding factor. But I don't think the criteria should necessarily say your income is going to be your income. Your output and your mission are going to be what they are. And I think we just keep it for ease of process. Because they have to present any financial information anyway, any organization.
Right. So. That's helpful. Chris, did you have something?
No, I was just curious to see if there's any other opinion, because this came up, as Jesse noted, based on some of the conversation that took place about should smaller organizations who don't have the same resources as larger organizations have the same requirements, or they may not have the same ability to address grants. And this was a way to try to address that based on some of the conversations and comments from the group. So again, that's what the point of this is, but I just wanted to make sure that was brought up, that this came from some of the comments. So if there was somebody who wanted to lean in on it, I just wanted to make sure we heard it.
Because we saw organizations that didn't have a big board of directors. We saw applications from them anyway. We still had to get people's finances. Are we saying, I can't remember what was brought up, are we saying that they don't have enough financial information because they're a small organization? Or what was it that was lacking that they felt was an unfair advantage or disadvantage?
It was more just around, like, if you're asking for $10,000 and you don't have a grant writer and you want to access this funds. But I do think I can mention here, I mentioned at the start, there were 3 areas I wanted to flag that we think will take more work. And one of them is related to this. One is related to more micro grants, like really smaller grants for more, sort of one-time purposes, or with less of a barrier of an application. We still heard you say that you do want to make, that there may be interest in looking at how to support smaller organizations with smaller funding, that you might not go through all this process for, $10,000 or $50,000. So that's something we'd like to explore in the coming year. The other one is vehicles. We know that there's a lot of interest in potentially addressing transportation. There are some places that are, I think Van is now buying vehicles with the ODCP funds. But we want to make sure we dot the I's and cross the T's. We're not going to be ready for that in this application cycle. So we're recommending we still leave it as no purchase of vehicles until we can come up with a way that you all can ensure they be used for actual direct service or the things you want them to go for. So we heard that. And it was micro grants, vehicles, and the third one just left my brain. But
capital campaigns, buildings.
Oh, incentive funding. So in terms of if there are particular areas of interest, like topical, you want to support recovery housing, how would the commission add funds to other grants? We heard sort of, or encouraging local communities to invest their funds by also giving a piece of the state funds. There was discussion around that. We just don't have the bandwidth right now to figure out what incentive funds for a particular type of work would look like.
Okay. But we do have prohibited expenditures.
Yes, and the only question here in some conversation, so we would remain with no vehicles. There'd still be no purchase of land. The one question that's come up a couple times is around the no construction, renovation, or permits related to construction or renovation. Renovation is a little bit broad. Clearly, we can say no construction and you can't pay for permits for construction or renovation, but I know you all have seen applications that ask for some support in rehabbing a recovery housing or doing some, and in the first round, there were grants that included that. So the real question here is, do you want to rule out renovation totally, or just consider those on a case-by-case basis?
I say case-by-case basis. If someone wants, I don't know, paint, I don't know. I mean, if it's a recovery house and it needs painting because they want to have a project, or if they want to do some landscaping. I mean, I know that's small when I say it out loud, but what if they want to make a closet into a food pantry or something? I don't know. I mean, is it a possibility to look at it case by case?
If recovery housing is a priority, which we said it was, then I think we have to allow for some things renovation like and upkeep and that type of thing.
Mm-hmm.
And then you can decide on a case-by-case basis if the construction ask, if the renovation construction piece is too major,
right,
that to undertake. But so then what I hear you saying is we'll take out the word renovation. We'll leave it as no construction or permits related to construction or renovation. literally that means
Right.
paying the permit fee. So, and then you can decide if it's too much or we can't afford to do that in the ask. Okay. You guys hung in there like champs. So our intention as staff is to use this to start drafting the notice of fundings, which we then hope to share with you likely at the November meeting. And then the intention would be then to open up the grant after that meeting.
All righty.
I wanted to add on the real estate issue, it's always going to be critical that we know who the title holder is on any real estate. I think that should always be a consideration, and whether the title holder to the property is approved of any improvements that these monies might be intended for. I think it's suspect when we agree to allow these monies to be used to improve real estate when the whole purpose of the grant is to do other things. And I can see where people can argue that we need to have facilities for this purpose. One of the grants that my office had when I was county attorney was there was a buy-in by the landowner and by the office owner that we would contribute our space as a contribution to the size of the grant itself. So we had an actual buy-in, or we had skin in the game. So I think it's important that we not lose sight of the importance of directing these monies towards lives as opposed to any improvement on real estate. Some of the best grants I think we had were those where we had government agencies and private agencies working together, and we didn't have these issues regarding improvements to real estate being part of the discussion. If you leave it on a case-by-case basis, I can always make these points and people can consider them as to their merit or lack of merit, but I think we need to be really careful about improvements to real estate, just like we've been very reluctant to involve ourselves with the leasing or purchase of vehicles. I think those are slippery slopes that we need to avoid if we can.
Thank you, Treasurer. That's helpful. As Jesse said, thank you very much for all of you going through this process. The thing that I would just like to remind you all is that, look, this is a great part of the effort to making sure that the funds are utilized in the best way as they can for the Commonwealth. So for you all to do this is a part of that process of making sure that we continue to get better in terms of how the funds are allocated, how they're used, and making sure they get to all the people that need them in the best way that they can. So thank you very much for taking the time today to do this, and we'll move forward. Being with the over, I just want to go ahead and move unless there's any other questions that somebody has, but otherwise I'd just like to move towards adjournment since we've taken more of your time. Did I hear a motion?
So moved.
Got a second?
Second.
Any discussion? All in favor?
Aye.
Any opposed? The motion passes. Thank you very much for everybody. We appreciate your time.
Thank you all.
Thank you.
Thank you.